Jaw issues. So TMJD, temporal mandibular joint disorder. We're using this guy who obviously has some issues. He's skelly. He's been with us for 40 something years, so all of his joints are falling apart. But the jaw, the TMJ, what attaches here and helps us open and close our mouth and grind food, move left and right. There's a bunch of little bitty muscles that attach through the sides, up here into the temple, some even internally and underneath. What can happen with the jaw most commonly is stress. I grind my teeth, or I always chew gum on the left side, and I end up compensating and developing muscles really tight on one side. And if it gets really tight here, then the jaw itself can actually shift. And now I start to deal with joint issues on the left and the right side, just like I can deal with the joint issue in my shoulder or my spine. If we're addressing jaw issues, I want to regain normal joint motion. So I'm working typically with people finding out where that joint dysfunction is, trying to help there. But we're also needing to address the muscles that attach into those areas. Perfect example of this is my wife. Whenever we started dating, she had jaw issues. I was trying to work on help with her. We've typically had really good success with jaw issues. Could not break through on hers. Went through extensive training. Went all around the U.S. to become very good at helping people with jaw issues. Now I'm very, very good at it. Of course, the rule of your spouse is the worst patient. She wasn't a bad patient. Hers was too far along, so she ended up having to have surgery. Just like with the spine, if things reach out of our limitation, then you have to go to that next level. But most people, if we can prevent surgery, it's by regaining normal joint function, addressing these muscular dysfunctions in there, and trying to regain normal function. So if you've got any issues, always earlier is better. Perfect world, I would have found my wife many years earlier and addressed that stuff before it reached the point that it had to, which was surgery. But if you've got those issues, give us a call. We'll see if we can help.